Hello, hello, hello. Another Saturday is here with us. And this is the Health and Wellness Show. Welcome to the Health and Wellness Show. My name is Ms. Del, as usual, and we're here to bring you another exciting program today. We're here to celebrate our fathers today. Yes, tomorrow is Father's Day, so we have something special for our fathers. So stay tuned, don't go anywhere. All right, okay then. So please share the link and invite your friends and loved ones to come and listen to the special information or special nuggets that we have for our fathers today. We celebrate our fathers, our brothers, wherever they are. Please, please, please share the link and invite people to come in and listen so we can all have the good news for today. Okay, all right. So as we do it as usual, our sister Sarah is here to give us a motivational message for the day. So over to you, Sister Sarah.
All right. Thank you very much, Ms. Dale. Happy Father's Day to all of our men, our fathers, our grandfathers, and all. Today, our motivational message is about being quiet and being able to receive or hear the directions and the promptings that we get. You know, even if you're not a Christian or you're not religious, the Spirit still speaks to you because you have a soul. And so the importance of listening to the voice that comes from our gut mainly is that it helps us in a lot of ways to avoid certain mistakes and certain misfortunes in our lives. And so I want to encourage everybody, pay attention because you've been getting these messages. Some people are more sensitive to receiving it than others. However, if you pay attention and you quiet your mind down, especially all the internal dialogue that we have going on in our minds and the argument we have with the people that are not around us or when we are by ourselves, you know, we just direct that attention to, you know, Spirit, what do I need to know? Or if there's a situation going on in your life, you ask, what should I do? Or you say that, okay, I have faith and I believe that all will work out well for my good, instead of just regurgitating the wrong narrative. You know, you want to listen, quiet your heart and your mind, listen to your heart, mostly not the rational mind, because usually the logical reasoning mind will kind of explain these feelings that you get, these impressions that you get away, because sometimes you don't have an explanation for how you're feeling. Why am I feeling odd? Why are things looking off? Why is this thing not the way I'm thinking it to be? When we ask follow-up questions, it helps the Spirit guide us to get better clarity on what we are supposed to do, rather than just feeling tensed and focusing on the situation. And as we all know, when we keep doing the same thing, expecting a different result, it doesn't happen. We need to change it up a little bit, how we're doing it, in order to get the different outcome or results that we're expecting. So just try it. Pay attention to how you feel about people, about places, and don't explain it away. Just stay with that feeling. Sometimes you don't need to call it out to the person or to the people. Just note it within yourself that I feel something unusual right now. And then ask that follow-up question. What am I supposed to do? What does this mean? And see what you get, because it has guided me a whole lot. And there are people out there who have testimonies also on this. So yes, that is the word or food for thought for this weekend. Have a wonderful weekend. Stay blessed.
Thank you so much, David Sarah. Thank you. We are blessed to have you here today again, once more, to give us those motivational messages. And thank you. We hold strong to it for the week, and we know that when we come back next time, you have much more for us. Thank you so much. God bless you. All right, viewers, welcome once again. This is the Health and Wellness Show. As I said earlier on, our sister Sarah just gave us our motivational message for the week as usual. So today we are celebrating our fathers. Yes, tomorrow is Father's Day. And so we have something special for our fathers today. So we said Father's Day check in. Okay, you know your numbers and own your health. What do our fathers need to know? Okay, so we have our special guest here today, Dr. Fafa Ehemeku. Doc, you're welcome.
Yeah, thank you, Ms. Dell.
All right then. So Dr. Fafa Ehemeku is a board-certified advanced cardiovascular imaging cardiologist at the Mercy Health Heart and Vascular Center in Janesville, Wisconsin, where he also serves as a faculty for the family residency and cardiovascular medicine fellowship programs. Dr. Ehemeku earned his medical degree from the University of Ghana Medical School, that's in Ghana, and completed an internal medicine residency at the Kolebu Teaching Hospital in Ghana, becoming a member of the West Africa College of Physicians. After relocating to the United States, he trained in internal medicine and cardiovascular medicine at Yale New Haven Health in Connecticut. He then completed his cardiac MRI fellowship at the Barts Heart Center, University College of London. Dr. Ehemeku was born and raised in Ho and is an alumnus of the Mawuli School. Okay. All right then. I don't know how they call the old students of Mawuli.
Havio.
Havio. So we have a special Havi here, right?
Yep.
Am I right? Okay. All right. This is tremendous. You're welcome, Doc. You're welcome to the Health and Wellness Show.
Thank you.
All right. So as I said earlier on, we're celebrating our fathers today. So I'll hand it over to Doc to take it up from here.
Okay. So good morning, and it's my pleasure to be joining you today. Thank you to Ms. Bell and Sienna for giving me the opportunity to give this talk, and happy Father's Day to all the fathers and potential fathers out there. God bless you for all the hard work you do to take care of your families, and we want to use the occasion to just check in, make sure we are staying on top of our health metrics and staying healthy. So basically, we'll be just a brief introduction, and then we'll focus on some important health indices for men, and we'll end with some choosing some healthy lifestyles that will help keep us healthy. So the life expectancy of a man on average here in the United States is 5 years less than women, and this is often due to preventable conditions. And it's mainly due to the fact that women are just notoriously prone to postponing routine checkups. So it's well known that we do a much better job taking our cars for regular servicing than we do scheduling routine checkups, so to make sure that we stay on top of our health metrics. So we do that so that we don't get that check engine light in our cars. So hopefully we'll begin to take our routine health checkups seriously. So it's vital to really understand these key health metrics, as they help to prevent long-term conditions such as heart disease and diabetes, and also prevent or afford early detection of cancers and better outcomes. So taking ownership of your health starts with knowing your numbers, and that's what we're going to be focusing on for today. So just a quick slide here to give us the leading causes of death in men here in the United States. So it's heart disease that most of us are aware of, and then followed by cancer, and then accidents, including unintentional injuries. So what are those numbers that we need to know and stay on top of? So the first one is blood pressure, and nearly half of US adults have elevated blood pressure, and it is the most important risk factor for heart disease and stroke. So it's common, and it's, if untreated, leads to significant disease and also death. And the unfortunate news is that many adults who have high blood pressure do not have it under control. I think the statistics says only about 1 in 4 patients who have high blood pressure have it controlled. And a lot more do not even know they have high blood pressure. So this is basically a slide to tell us what normal blood pressure is, and I'm not going to go through the whole slide. It's available online, but normal blood pressure is less than 120 for the systolic number, which is the top number, and then less than 80 for the bottom number. And then if you do have true hypertension, it's when you're above 130/80. I just make a quick point that whenever you check your blood pressure and it's reading 180/120 or higher, that will be an indication to call your healthcare provider immediately, because that's severe hypertension and could lead to serious conditions. So the magic number when it comes to blood pressure is 120/80. So that's your normal blood pressure. Anything higher than that means either we have to start lifestyle changes or medications to get our blood pressure to goal. So how often do you have to check your blood pressure? If you are between 18 and 39, every couple of years to every 5 years will be reasonable, if assuming your last check was completely normal. If you are 40 plus or higher risk, and that will include blacks in general, you should check your blood pressure at least once a year. There's a correct way where paradigm have shifted from depending on office blood pressure readings and to really focus on blood pressure readings at home. So this is just a slide to teach us how to accurately check our blood pressure. And for most, especially if you do have high blood pressure, you should have a blood pressure cuff at home to check your blood pressure so that you could provide you could send those readings to your healthcare provider for appropriate recommendations and treatment. This is just another slide. If you want to get a blood pressure device that you can trust, there's a list of validated blood pressures at this website, validatebp.org. So the next number we need to focus on is our cholesterol levels. And the only way to find out this is to get a blood test, which is ordered by your healthcare provider. Usually done as a fasting test, but if it's a screening test, you could also do it non-fasting. And it's called a lipid profile or a lipid panel. And the number that you remember is if your total cholesterol is greater than 200, that is your cholesterol is higher than, or your cholesterol levels are abnormally high. It's a little bit more nuanced depending on what's going on, but that's a general number to keep in mind. For optimal cholesterol levels, these are the levels we are looking at. We usually want your LDL, which is your bad cholesterol, to be below 100 and your triglycerides to be less than 150. So how often should you check your cholesterol? If you have a normal cholesterol blood work as starting to an adult, then you will check every 4 to 6 years. If it's abnormal, most your primary care will usually check your cholesterol levels every year to just track those numbers and decide whether you need treatment or monitor your numbers while on treatment. This may be one that you may not be familiar with, called the lipoprotein A, or the Lp(a). And it's a nasty cousin of bad cholesterol, the LDL cholesterol, that can increase your risk of a heart attack or stroke. And it's fairly common. About 20% of people worldwide have an elevated Lp(a) level. And that number is 125 nanomoles per liter. We used to do this in more high-risk patients, but the American College of Cardiology and American Heart Association in their recent guidelines released this year have recommended that everybody should get a one-time screening test for Lp(a) level. So something to ask your doctor about in case they do not order that when you go for your next routine checking. The next big number is your blood glucose. And unfortunately, diabetes is a very common one. In 8 adults in the US have diabetes. And unfortunately, about 25% of people are walking around with diabetes and don't know that they have it. So why is diabetes important? Commonest cause of blindness and kidney failure now in the US. A lot of heart disease, stroke, and then loss of limbs. So what we know about diabetes mostly is the fasting blood glucose. The number that you remember is normal, is less than 100. And if you have diabetes, it's 126 or greater. In between, you have pre-diabetes. We don't use fasting blood glucose that often. What we use now for mainly diagnosis is your glycated hemoglobin level, or your HbA1c, or just your A1c. And the number there, the normal is less than 5.7. 6.5 of above is diabetes. In between is pre-diabetes. And this is what you normally see providers ordering these days to screen for diabetes. If you do have a normal blood glucose level or HbA1c and you are 35 to 40 or older, then we check every 3 years. If you do have risk factors, again, that will include Black men, then you should be checking your blood glucose or your HbA1c every 1 to 2 years. If you've been diagnosed with pre-diabetes, then that needs to be checked annually. The next will be your body mass index. And we know obesity is common, it's serious, and it's a costly chronic disease here, which is a driver of high blood pressure and diabetes and other cardiovascular risk factors. And unfortunately, 2 out of 5 adults here in the US have obesity. I think about 2/3 of us are either overweight or obese. Not a very accurate marker for your risk of heart disease and diabetes, but still there's a lot of treatments and that are based on your BMI. So it's useful, but not a very accurate marker of your risk of cardiovascular disease and diabetes. So here is the normal BMI is normal BMI is 18.5 to 25. And then obesity is when your BMI is 30 or greater and then goes to grace. And then when you severe or morbid obesity is when it's above 40. Another marker or another number that you want to keep an eye on, which better tracks your risk of heart disease and developing diabetes, or what we call the metabolic syndrome, is your waist circumference. And this picture shows where you're supposed to measure. Hopefully, those of us in this category will be slowly moving to this one. So the normal number is, if it's below 37, but you have high risk for developing heart disease and diabetes if your waist circumference is greater than 14 inches. Gone were the days when we were growing up, they said, oh, a pot belly was a sign of good living. Unfortunately, all that fat doesn't do you a lot of good. So we should make sure our waist circumference at least below 40 and ideally below 37 inches. The next number that we want to know is our prostate-specific antigen. And we know that prostate cancer is the commonest cancer among men in the US if you exclude skin cancers, not non-melanoma skin cancers. Unfortunately, Black men are 70% more likely to develop prostate cancer and twice as likely to die from it compared to white men. So it tends to be a little more common and more aggressive in Black men compared to Caucasians. When it comes to prostate cancer screening, a little bit of a controversy in terms of exactly what to do, but the U.S. Preventative Services Task Force, which is the U.S. government body that normally makes recommendations regards to screening for various disease conditions, say you should have a discussion. They do not recommend that you get a PSA, but they ask for you to have a discussion with your provider to discuss the risk versus benefits when you are between 55 to 69 years of age. And they do not recommend screening when you're 70 years or older. However, there are other groups like the American Cancer Society, which recommend that Black men begin discussion with their healthcare provider about prostate cancer starting at age 45. And again, you go over the risk versus benefits, though implicitly they suggest that you get a PSA, but you want to have a discussion about the risk versus benefits. And if you do have a first-degree relative that has had prostate cancer, then that conversation should be starting at age 40. So if you do screen and you have a PSA below 1.0, then you recheck every 2 to 4 years. If it's between 1.0 and 3.0, you recheck every 1 to 2 years. If it's above 3.0, then that will mean that you may need further testing, or your primary provider may refer you to see a urologist for further evaluation. This last one is not necessarily a number, but also very important. It's colon cancer screening. And the recommendation here, according to the USPSTF, is to be screened between ages 45 to 75. Prior, this new, it used to be starting at age 50, but a few years ago, that age, it was dropped to 45 to 75, starting at 45 instead of 50, and the screening ended at age 75. That's assuming you had a normal screening at age 75. So what are the screening tests that we have for colon cancer? We have the fecal occult blood test, which the test for blood in your stool is done every 1 to 2 years. Not very popular now. The more popular stool test is the DNA stool test, of which the commonest is Cologuard. And we probably may have seen the adverts, or some of us may have done this. And this and you don't need to make any changes to your diet before you do this one. You need to do that for the fecal occult blood test. So this is done every 3 years. And then we do have the virtual colonoscopy, where you do a CT scan that can be done every 5 years. The downside of that is that it comes with radiation, and there may be false positive studies, and then you end up with a colonoscopy. We do have a sigmoidoscopy, not done very often, but you could do that every 5 to 10 years if you also do some stool tests in addition, because you just look into part of the colon where most colon cancers occur, but then the rest of the colon is not viewed during a sigmoidoscopy. The gold standard is a colonoscopy, and I know it's the favorite of a lot of people because the prep is very exciting. So this is done. You need to do a prep for it, and it's done every 10 years, assuming you have you don't have any high-risk features, and your colonoscopy is normal. Just to end, will be to encourage us to adopt healthy habits, and that starts with our diet. A good overall diet will be what we call the Mediterranean diet, and you could look it up. We talked about keeping a healthy weight, get regular physical activity. The recommendation there is to do 150 minutes a week of moderate to intense aerobic activity, which is anything from brisk walking to vigorous exercise. Let's avoid smoking. Let's get good sleep. A good number is 7 to 9 hours of sleep. I know we are all busy and sometimes we don't get that, but it's very important. And then we also want to learn to manage stress, because that also directly and indirectly affects our heart health and other health conditions. So just to conclude, routine preventative screenings are the key to catching potential issues before they start, and staying on top of these core vitals and scheduling regular checkups can protect your heart, manage your blood sugar, and detect cancers early. And just to go over those things that we talked about was your blood pressure, your cholesterol, your blood sugar, and we talked about your prostate-specific antigen, and then we also added something for colorectal or colon cancer screening. And thank you very much for your time.
All right, then. Awesome. Thank you so much, Doc. These are vital information that our men need to know. So please, if you're watching us, share this link to your father, your husband, your brother, any other male that you know out there. Please share the link and let them listen to it, so they can also get something from it. If there are some tests that they've now been doing, some checks that they're supposed to be doing that they're not, please send it to them so they'll be able to go get it done, or they can go get themselves checked. You never know the lives that you're saving. I keep saying it. Just one link, just sharing this link to somebody out there, somebody you don't even know, on your social media platform, wherever, on your church platform, or your social groups. No, you never know the life that you're going to be saving. So please share the link, share the information, let them listen to it so they can take action. Thank you so much, Doug. So at this point, we'll take a commercial. No, I'll go ahead and announce the other programs that we have on this show or on this channel. And then when I come back, we'll take questions. So please, if you have any questions, you can type them in the comment section. Any question, any comments that you have, please put it in the comment section. And then when we come back, I will, Doc is going to help us answer the questions. All right, then. Okay. So as I said earlier on, this is Sienna Media TV. We are on Facebook. We are on YouTube. And there are some other programs that go on here on this channel. So gracefully, and then we'll come back and take your questions and your comments. Okay, so on Friday, DJ Mawenyega comes our way with the African jazz and traditional music panorama. So if you need some music for your dancing feet on Friday or for your relaxation, don't hesitate to tune in into this channel on Friday evenings. He comes on 8 p.m. Eastern Standard Time or 7 p.m. Central Standard Time. Trust me, some very, very good music goes on here, especially African rich music. So please don't hesitate. Just try it this coming Friday, and you thank me later. All right, then. So that's it for Fridays, and then Saturday mornings we are here with the Health and Wellness Hub. We come on here with different health topics. We have different healthcare professionals, doctors, nurses, nurse practitioners, and what have you will come here to educate us on our health and wellness. Okay, so we're trying to live healthy so we can enjoy all that God has for us. So please always tune in. We also come on here every Saturday, 9:30 a.m. Central Standard Time or 10:30 a.m. Eastern Standard Time. We are here. Even if you're in Ghana, please, you can always watch. You can always send a link to your loved ones to also watch and learn from it. Okay. All right. So after our show, me and Empress Mousy and Efo Steve also come our way with the Senior Central talk show. Everything that goes on here concerning Sienna, our projects, upcoming conventions, and everything that is going on with the individual associations that form Sienna. This is where the show goes on about Sienna. So that is right after our show here on the Health and Wellness Hub. So it comes on at 11 a.m. to 12 noon Eastern Standard Time. So there you go. Yeah. That is for the Sienna Central Talk Show. And then after that, all the way to Ghana, our sister, Mama Emepa, also comes our way with Junenyo Bobobo Show. She hosts it in collaboration with Top Radio in Ghana. And then they stream live. She also comes on. She talks to other people in Ghana. And then if you want to listen to some authentic Bobobo music as well, just come on and you will hear that. So that comes on. That is, and Ghana time is 5 to 8 p.m. That's evening in Ghana. Indian is 1 p.m. to 3 p.m. Eastern Standard Time here. So 1 p.m. here will be like Eastern Standard Time, 1 p.m. So that will be 12 p.m. Central Standard Time. All right. And then after that, there comes our way with Miss Strawberry. Yeah, we're trying to learn our language, our rich ever language. So Dr. Cyrus, Dr. Dogbe, Dr. Wanyo, and his entourage, they all come here to teach us our rich ever language. So especially for our children who were born here out of the continent in Africa, most of them don't speak our language. So this is the avenue, this is the place to log them in so they can also learn our language. So when they go back home, they will not be strangers. All right. So that's about it for the shows on Saturday. And then on Sunday, our sister Nicole comes our way with Faith and Culture. Faith and Culture. She comes our way every Sunday. That's 4 p.m. Eastern Standard Time. That'll be 3 p.m. Central Standard Time and 9 p.m. GMT. That's Ghana time. So basically, these are the shows that stream live here on this channel, the Sienna Media channel. Kindly share the link, always log on and enjoy these shows that we have. There are a lot more shows that will be coming our way later on, but for now, these are the shows that we have. Okay. All right, so let's see if we have some questions. And then I'll bring Doc back on stage so we can go through the questions that we have. If you have any question, any comments, kindly send it, please. Especially our men watching us. Please ask any question, please. All right. So, Doc, so are there any other tests or other than the ones that you've presented that can help assess the risks of a heart attack?
Yeah, that's a great question. And there's a number called the coronary artery calcium score, which I didn't put up there because it's not universally recommended, but it's the best test that we have available to detect heart disease before it becomes an issue, what we call subclinical coronary artery disease. And we recommend this. It's more individualized. It's, as I said, it's not a routine screening for everybody. People who have a family history of heart disease, or especially what we'll call family history of premature heart disease, which means you have a family, a first-degree relative who is a male who had a heart attack or was diagnosed with coronary disease before age 45. Sorry, age 55, or for women before age 65. And that will, so we use this test. It detects plaque or calcified plaque in your coronary arteries, and it very strongly tracks your risk of heart attacks. And we also use this in patients who have high cholesterol, not very high risk. If usually if we look at your cholesterol numbers, we plug it into an equation called the Prevent ASCVD risk equation, and then we determine what is your 10-year risk of having a heart attack or a stroke. Some people are low risk, you kind of leave them alone in terms of treatment. Some people are high risk, treatment is strongly recommended, and you have people who fall in the intermediate risk, which treatment may be reasonable, and some people may be a little hesitant to go on treatment. And we use this as for further risk stratification, where we do this test, and the numbers help us decide whether you should really be on a cholesterol medication or we can keep watching. And sometimes you'll be surprised if you use the equation, people may not be that high risk, but you have them do a calcium score test and their numbers are very high, and we pick those up, put them on appropriate treatment, and hopefully significantly reduce their risk of having a heart attack or a stroke. So that's a good question to ask your primary care provider. If you're not sure in your cholesterol, just to ask them, do you think I will benefit from a coronary artery calcium scoring? It's a CAT scan done without contrast. Unfortunately, you have to pay out of pocket, but most places I say it's between $25 to $100 for a test, and I think it's an investment that is worth it. In my hospital, we pay about the out-of-pocket cost is $49. So it's not too much, but not covered by insurance, but absolutely worth it if your healthcare provider thinks you need it.
Wow. It's definitely, worth it, because that's below $100, which I think most people should be able to afford, if you're looking at the risks, So yeah. Okay. So we don't have any other questions, but Sister Bridget says, good morning, Miss Dale and Sister Sarah. Good morning, Sister Bridget. Good morning for watching us. Okay. So with all these, Doc, another question, with all these tests, do you have to wait for your doctors or your PCP to recommend it, or you have to ask for the tests?
Oh, I think for the ones I talk about, most primary care providers will be recommending them, and this is fairly routine, so I don't think in terms of of course, when you go in, they're going to check your blood pressure, so that's not an issue. They'll usually screen you for diabetes, check your cholesterol, and then your weight and its height is taken. And so usually I think these are routine tests that almost always will be ordered by your primary care provider for screening, and you have to have a conversation about the PSA test. They are usually on top of it when it comes to the colon cancer screening. And I think the new one that I mentioned, which is just was just recommended within the last couple of months, is the LP(a) level. So that is something that I will encourage our men, and generally everybody, it's not just the men, to make sure they remind their primary care providers to do that one-time screening test for the LP(a). As I said, it's very common. About 20% of people worldwide have an elevated LP(a) level, and the number there is usually 75 is low risk, but your risk significantly goes up if it goes above 125, but below 75 is considered normal. So that will be one that I will say, at least for the next couple of years, until it becomes part of what is routine screening, we should remind our primary care providers to screen us for, to order the test for LP(a) level.
Oh, okay. So that means the tests that are not routine will have to be paid out of pocket, right? Most insurances will not cover it.
all these other ones include the elevated LP level, little A level, will be covered by insurance, and
Okay.
usually, yeah. So every insurance is supposed to cover this as primary prevention screening test. So this will all be covered. The only one which is not covered at this time, which we talked about a couple of minutes ago, is the coronary artery calcium score.
Okay, sounds good. All right then, good to know. So please let's share the information. Oh, and I learned one new word today. That you mentioned the Sogno something. There's another test that when you were talking about the colonoscopy.
Oh, the sigmoidoscopy.
Sigmoidoscopy, yeah.
Yeah, so it's kind of a partial form of a colonoscopy because it doesn't look at the whole colon, and because of that, it's not very common. Because if you do it, then you got to be doing the stool test in addition, because it looks at the part of the colon where most colon cancers happen, but then you could have colon at the beginning and the middle part of the colon, which it doesn't cover. So yeah, so it's there. People could do it, but I say usually either people are doing the DNA stool tests like Cologuard, or are doing colonoscopies. Yeah, but there are these other ones that are available in case for one reason or the other you want to. You could always discuss those with your primary care providers in terms of the test that is best for you.
All right. Thank you so much, Doc. Thank you, viewers. Thank you for watching us. Thank you for listening in. Today, Doc has spoken to us, especially to our fathers out there, the standard tests that everyone is supposed to be taking. Please share this link. I keep saying it. Share this link to your loved ones, to your friends, even people you do not know. Just put it out there on your social media platform, because you never know the lives that you will save just for putting just this information on there for somebody also to learn from. So let's spread the news. We're all trying to live healthy so we can enjoy all the good things that God has for us. All the struggles that we're struggling back and forth every day, we need to live healthy so we can enjoy them, the fruits of our labor. So please share the link, invite people to also listen to it. And thank God this is on YouTube. You can always go back, listen to it, put down the points or the tests that you think you haven't been able to done over the years. Please go back to your PCP, go back to your doctors and tell them to help you get all those things done for you, so we can at least have the peace of mind that we are okay for now. So thank you, Doc. We are very grateful. We know you're very busy, but you made time to be with us today. So we say thank you once again, and thank you, viewers, for also watching. All too soon, another session is over. We've come to the end of the show, and we want to wish our fathers a happy Father's Day. Happy Father's Day to all our fathers out there. We appreciate you. We are praying for God's blessings upon your life. So please stay healthy so you can enjoy the blessings out there. And happy Father's Day to you as well, Doc. We really appreciate you.
Thank you, Ms. Dill.
So until we come your way again next time, please stay healthy and stay strong. And remember, your health is your wealth. Bye for now.